Hey everyone, thank you so much for checking out my channel, Travel with a Twist. And this week is part 1 of 2 of videos where I'm discussing the treatment options for polycystic kidney disease. So in previous videos, I haven't mentioned yet that polycystic kidney disease has no cure at the moment. However, we do have our very first and only FDA approved medication to help slow down the progression of polycystic kidney disease. So I'm going to be sharing information with you about that today, how it works and my experience with it. And then next week I will talk about the other treatment options, which are dialysis and kidney transplant once the disease has fully progressed and resulted in kidney failure. So today we'll talk about the medication, and then I will share with you something I'm looking forward to after transplant, and then finish with my travel tip of the week. So today we are talking about Jynarque is the brand name, tolvaptan is the generic name, and this is a medication that was recently FDA approved on April 23rd, 2018. So not too long ago, and it was a very monumental day because this is the very first and only FDA approved medication to help slow the progression of kidney disease with polycystic kidney patients and slow the decline of kidney function. So this medication is very exciting. It is for adults only at the moment. There hasn't been a lot of research done on patients under the age of 18 as of yet. But it is a medication used for patients with rapidly progressing polycystic kidney disease, autosomal dominant, and Jynarque website defines rapidly progressing as patients that have a GFR drop of greater than 5 over the course of 1 year, or a GFR drop of greater or equal to 2.5 per year for 5 years. So there's a variety of ways that people can qualify for this rapidly progressing. Like I mentioned in the last video, a lot of patients with polycystic kidney disease type 1 have the rapidly progressing variation. So that is some criteria that may qualify, as well as patients that just have a lot of issues with their kidneys, if they have large kidneys at a young age, or if they have a lot of extra symptoms like pain, bleeding, blood pressure issues, things like that. And so this medication is a long-term medication. So the idea is that over the course of taking this medication, it will slow down the overall progression and decline of kidney function. So how this medication works is there is a hormone that floats around in the fluids of the body on the outside of the cells called vasopressin, otherwise known as antidiuretic hormone. And I have a couple visuals here for you to see this a little better. So the first visual is of the nephron, which is the cells of the kidney. And on the outside, you can see these receptors. And so this vasopressin hormone will attach to the receptors on the kidney, and that will promote the kidney to increase the fluid reabsorption in the body and ultimately return that back to circulation. And so patients with polycystic kidney disease have an abundance of this vasopressin hormone, and so that can contribute to the increased cyst growth as well as the increased fluid in the cyst. And so it'll cause the cyst to get larger and more full of fluid. And so the second diagram I have here is a picture of how it works with being on Jynarque. And as you see, this medication will actually bind to the receptors on the kidney cells instead of the vasopressin. So essentially blocks the vasopressin. And so that will ultimately slow down the increase of cell proliferation, as well as slow down the amount of fluid that is obtained in the cells to create the cyst. And so the idea is that the more medication that is used over a long period of time, the lower amount of vasopressin is in the patient's body, and so it will slow the decline of kidney function as well as the progression of this disease. And so Jynarque is currently only available at specialty pharmacies because of the issue of some patients developed liver problems when doing trials for this medication. And so it is monitored very closely, and the providers have to do diligent paperwork every month to show that the patient is being compliant with the required laboratory testing that is done. So in order to get on this medication, the patient has to have a baseline lab draw that includes not only the kidney function, but also liver testing enzymes to make sure that the liver is functioning properly before starting the medication. And then after you're on the medication, you get a lab done 2 weeks after, 4 weeks after, and then the first 18 months you're on the medication, you get it checked once a month just to make sure that it's not causing any liver issues. And then after the 18 months, then you get it checked once every 3 months for the rest of the time you're on the medication. And so there are 3 different dosing levels of this medication. There's an initial dosing level that has a 45 milligram tablet that you take in the morning, and then followed by a 15 milligram tablet 8 hours later. And then the middle dosing level is a 60 milligram tablet followed by a 30 milligram 8 hours later. And then the ideal target dosing for this medication is a 90 milligram tablet in the morning followed by a 30 milligram tablet in the evening, 8 hours later. So the idea with that is that this medication is known to cause a great amount of thirst and a high volume of urine production as its main side effects. And so spacing it out a little bit and taking the second one 8 hours later tries to help balancing out that urination and that fluid need for patients, so they won't have to hopefully go as much during the night or something like that. So I was actually on this medication for 3 years. I started it, I believe it was June of 2019, and I stopped it October of 2022. And so it's been almost 2 years since I've been off the medication. The only reason I got off of it was because I was trying to get onto another trial for a new medication, and I couldn't be on this one while I was trying to get on that trial. So, and then I just kind of decided not to get back onto it. I think I had a GFR of like 25, 26 at that time. And my doctor had said that there's not a whole lot of data showing if it's super beneficial or not still at that range of GFR. So I kind of just decided to not get back on it because I was already having trouble sleeping, and it did make me have to get up and go to the bathroom a lot at night. But I'm really grateful and really happy that I was able to be on that medication. It was a very monumental day for me when I got it in the mail. I felt very honored and privileged to be able to have the opportunity to be on a medication like this. I have, a lot of family members that never got the opportunity, a lot of other patients before me that have never gotten the opportunity to try and do something proactive to slow down your disease. And so this was a really big deal for me to be on this medication. And my doctor initially had said that he thought I would probably need a transplant by the time I was 35. And so I was on the medication for like 3 years, and I'm going to be 36 in 2 months. And so I feel like it has definitely given me some extra time. And obviously, like, I'm on the transplant list right now, but it's definitely given me some extra time. So I feel grateful for the opportunity. And my sister actually just started on the medication, so hopefully it'll give her a lot of extra time until she has to get down to this stage. So that was a little bit about my experience with Jynarque. I really enjoyed it. It's not for everybody. I know that a lot of people do have a hard time with managing the urination and the constant thirst. I was fortunate enough to be able to get up to the highest dose and tolerate that okay. And so it was really great though, because there was constantly being monitored by my doctor and by the pharmaceutical company, checking in on me, making sure I wasn't having any issues. They have advocates to talk to. So they really do their best to try and make it something to really help patients. I know they're working on some other things now too to try and decrease the amount of urination and that kind of thing. So I really enjoyed my experience with it, and I'm glad that I got the opportunity to be a part of that. So for something I'm looking forward to after transplant this week is I am looking forward to not having to get my monthly injections anymore. So I kind of mentioned this in another video. I get Aranesp injections once a month. It's to help with my anemia, kind of get my hemoglobin up a little higher. They want it around 11, and with my kidney disease, it's usually around 10-ish. This last week it was 9.2, and so this medication helps to prevent me from needing blood transfusions, and then also tries to give me a little boost of energy once a month. But they're actually kind of painful when I get them. I either have to get 1 or 2 shots depending on the dosage that I need. And so this last week when I got it, I had to get 2 shots because I was lower than usual. And so they actually give them in the subcutaneous layer in the back of the arm here. And it kind of feels like a long bee sting. Like it goes in and it burns a little bit, and they put it in slowly, so like to kind of try and ease it a little bit, but it definitely doesn't feel the greatest. So I'm really looking forward to not having to do that and not having to pay for them every month too. That'll be really nice. So yeah, and then my travel tip for the week is I would recommend that anytime you're traveling, especially for patients on Jynarque, if you see a bathroom, use it. Especially over in Europe and places like that, a lot of places you visit, public bathrooms aren't readily available, or sometimes you have to pay for them. And so if you see a public bathroom for free especially, I always try and take advantage and try and make something happen. So I'm not kind of like running around worried about where I'm gonna go to the bathroom next. So that is my travel tip for this week. Thank you guys so much for checking out my video, and I will have the second portion of this treatments options next week for you. And thanks again. Please like and share, and have a great day.